In this video, I'm going to go over different ways that you can help manage your symptoms related to plantar fasciitis. Before we get any further into the video though, let's make sure you're actually dealing with plantar fasciitis. You can click the link up above. I made a video that goes over plantar fasciitis, the typical signs and symptoms of plantar fasciitis. But most importantly, I go over other diagnoses and conditions that pretend to be plantar fasciitis and give you some insight onto what those conditions and treatments or not treatments, but diagnoses look like. So go ahead and check that video out, especially if you haven't been actually diagnosed with plantar fasciitis, or maybe that you have been diagnosed with plantar fasciitis, have been doing things for it and it's still not getting better. Go ahead and check that out. Make sure that you weren't misdiagnosed as well. So there are a handful of different things that you can do to manage your symptoms related to plantar fasciitis. And so let's go right into those right now. The first one is corticosteroid injection. Now, I am biased and I definitely would not recommend this as a first line of defense, and I definitely wouldn't recommend it as a standalone intervention. In fact, most research points that if you do get a steroid injection of cortisone into your heel or the bottom of your foot, combining that with other modalities such as strength training and other physical therapy can be really helpful in improving your symptoms. However, there's also research that's out there that demonstrates an actual rupture of the plantar fascia because of a steroid injection. The next one that most people really think of is changing up your shoes. And this has a lot of research behind it, and honestly, there's way too much to go into here, and it is slightly mixed. This isn't going to be the best advice in the world, but if you find a shoe and it's comfortable and really helps with your symptoms, perfect. Keep wearing that shoe, and or find something that's very similar. If there's a shoe that is not really helpful or makes your symptoms worse, obviously stop wearing that shoe. Again, not the best advice possible, but also trying to be very broad and helping as many people as possible. Next one is orthoses or orthotics. There's a lot of thought and behind what your foot structure is like and how that may actually contribute to your symptoms. A lot of research based on biomechanics and foot structure is a little mixed when it comes to plantar fasciitis. So orthoses and orthotics research is also a little mixed as well. However, there is some research that does support having orthotics, whether that's over the counter or custom made, can be really helpful for medium term kind of pain relief. So a little bit more so than 4 to 6 weeks, but probably also not great for long term relief either. There's also research that points that custom orthotics are actually no better than over the counter orthotics. So if you're looking to save some money, make sure you start off with buying some orthotics over the counter before you go ahead and spend some big bucks on custom orthotics. Next, let's talk about ice. Ice is likely to be used, especially in these inflammatory tendinitis, itis kind of conditions. Just know that ice can be helpful, although there's a lot of debate right now if ice is helpful in that acute kind of inflammatory stage if you're dealing with something like that. Now, ice can be really good when it comes to pain and for pain relief. If you have been dealing with plantar fasciitis symptoms for some time, we'll probably know that you're not actually dealing with an acute inflammatory process, and in fact, inflammation is probably not even occurring in your heel or at the bottom of your foot if you have been dealing with symptoms for a while. So ice is not going to really do anything in terms of decreasing any inflammation there because it's probably not happening, to be honest. However, again, ice can be really helpful with pain, so if it is helpful for your pain, go ahead and do it. However, don't feel like you have to ice because it's not necessary. Now, for one of the biggest things that we can do for plantar fasciitis is really load management. Now, if you're an athlete or a runner and this is what's bothering you, making a change to your current training regimen, and that might mean not running, even if it's just for a short time, although I don't always recommend stopping the thing that you love or enjoy doing. However, if that is necessary, there are other ways that you can train to keep your fitness up, whether that's cross training, so that could be swimming, biking, rowing, some of those things. But again, that doesn't necessarily mean that you have to give up running if it's something that you love and enjoy. Other things that you can modify include load, the frequency of how much you're training, the intensity, so maybe drawing back your speed potentially, and even the duration. So maybe if you're used to going out for a run for an hour, maybe draw that back half and let's go for 30 minutes and see how you do. Most importantly, even if you're not an athlete, those are all things that you should utilize and as well when it comes to your regular activities to see what you can do to help modify your symptoms. Now, when it comes to load management and training with plantar fasciitis, you are going to have pain. Pain is part of the process, but we want to make sure that it's tolerable. So if you're doing an activity and you are having pain, but it is tolerable and your symptoms are not worse later in the day or the next day, know that you're doing an okay thing, and that's okay. You're probably not going to be completely pain-free. But again, as long as your pain is tolerable and it's not worse later in the day or the following day, just know that you're making progress and you're probably headed in the right direction. Lastly, let's talk about exercise. One of my favorite things, especially as a physical therapist, is to give people exercises to really help load and strengthen the structures that are affected, even some of the structures that are around the area. Now, this is not an all-inclusive list. Everyone's rehab looks completely different, and so just know that just these few exercises are not the things that you should be focused on, and there are other things that should be done. If you haven't checked it out, I have made a video of my 2 favorite exercises that I like to utilize with my clients who are dealing with plantar fasciitis. Go ahead and check that out. In addition to those 2 exercises, I want to just show a couple of things that you can do and utilize to really help with your symptoms as well that I didn't go over in that video that I just mentioned. Before we get into those exercises, if you have been finding this video helpful and valuable, please hit that like button down below. And if you want to get more videos just like this to help you get out of pain, manage your symptoms, perform your best in and out of the gym, and just with everyday activities that you love to do and enjoy, please hit that subscribe button. Any of those actions really help me and the channel out, and I truly appreciate it. So these are some treatments and exercises and different things that I like to utilize for my patients with plantar fasciitis. You've probably done this before. You can use a lacrosse ball, a tennis ball, a golf ball, a mobility ball, whatever it is, it doesn't really matter. You can just place that on the floor and go ahead and rub and mobilize some of those tissues along the bottom of your foot. Now, depending on how painful you are, you can press harder or less depending, again, on your symptoms and how irritable and painful they currently are. Just know that we're not lengthening or changing or breaking up adhesions when we do this. All we're doing is decreasing the sensitivity to the tissues in that area by making a change to our nerves, our nervous system, and our brain. Therefore, being able to tolerate activities a little bit better by doing this drill. Staying with this soft tissue mobilization theme, you can get one of these fancy little tools, or if you don't have one of these or don't want to buy one, you can just use a rolling pin. But we're going to hit some of those muscles along the back side of the calf here. So all you have to do is stay seated. You can lie down with your legs out straight but bent up, so your knees are bent so you can get to this. And then we're just going to mobilize some of the tissues along our calf. So we're getting the gastroc. Of course, we're going to be getting some of the other calf muscles, like the deeper one, like the soleus. And we're just going to go ahead and go through there. Just find some of those maybe sore spots or tight spots that may be contributing to some of those symptoms in the bottom of your foot and your heel. Lastly, one other move that I like to utilize is some direct strengthening for the calf muscle. This one is going to target the soleus, that deeper calf muscle here. All you need is some sort of weight. It doesn't have to be a kettlebell or a dumbbell. You can just put some books or a bag of some items that are heavy. You're going to just place that right on top of your knee with the ball of your foot on a step, your heel kind of hanging off. We're going to go all the way up onto our toes as far as we can, and then lower back down nice and slow, going through that full range of motion. Again, we're obviously targeting the calf muscles. That's going to directly affect the Achilles, the plantar fascia, and some of the other muscles in our foot as well, which again, overall, will be helpful for the symptoms that you're experiencing in the bottom of your foot. Those are some of the best research ways to manage your symptoms when it comes to plantar fasciitis. Again, if you found this video helpful and valuable, please hit that like button down below. And if you want more videos just like this, please hit that subscribe button. All of those actions really help me and the channel out, and I really appreciate it.